Hi everybody. Today we are talking about regenerative aging using the lymph system. And I have a special guest, Leah Levitan. I'm gonna see if I can get you on here. I'm such a big fan. I'll let you guys start coming on. Let me see if I can get her. Yes. Hello. For those of you who are new to this channel, I am Darnell Cox. I'm 55 years old. I'm a gerontologist and a healthy aging coach. I'm here every Saturday at 11 a.m. where we talk all subjects about healthy aging. Today is about reversing aging using your lymphatic system. So I have a special guest. I'm waiting for Leah to come on. Let's see if I can get her on. Hi everybody. Hello. Oh, thank you so much. You know what? It's October. I'm like, should I break out the orange? I think I should break out the orange. Hi, everybody. Okay, let's see. Yes, view request. Yay. Hi, New Jersey. Hello. Okay, let's see if I can get her to get on here. Sometimes we have a little bit of a, yes, yay.
Hi, how are you?
I'm great. How are you doing, Leah? I'm so honored that you're here. I'm a giant fan.
Oh, thank you.
Giant fan.
Thank you so much. I am a giant fan of the lymphatic system. So we're just two peas in a pod.
Lymph is having a moment. It's having a moment right now, isn't it? Thank
sure
God. Yeah, because it's a lot more than, for those of you who are on here for, my beauty hacks and ways to look and feel your best at every age. Look, feel, function. That's what we're doing. But lymphatic system is way more complicated than that. So first of all, Leah, how did you get into this? Because it's a very small niche here, but it has huge impact.
Yeah, it's a niche for sure. So I got certified with a company known as Rock Tape, and they had a really special instructor. His name is Dr. Perry Nicholson. And so I like to call him my virtual mentor. He's got a great little page here. He's probably been doing this about 15 years. So he was probably talking about lymph before it was cool. Please give him a follow at Stop Chasing Pain. And yeah, that sort of was like the first taste and introduction that I got to the lymphatic system. And I was so moved by his story and how he kind of came back from an autoimmune condition and all kinds of health problems. And I just, as a massage therapist, I'd always sort of focused on the physical structure of the body and not really paying much attention to the vital organs and the other systems. I knew everything worked together, but I don't know, this was the ticket. It really was. And my mom's a breast cancer survivor, so.
Wow. Okay. So, and this is the lymphatic drainage and dealing with the lymphatic system. It's like I was saying, it's much more than just moving fluid around, because the fluid contains toxins that our body's trying to get rid of. Yeah. Right?
Yeah, that's correct. Mm-hmm.
Yeah. So tell me a little bit about, just because, I'm sorry about your mother, but it's used a lot in cancer treatment, right? Because you're trying to get all of those toxins from the chemo out of the body.
Well,
so how
it's very supportive to the lymphatic too.
Yeah. So let's talk about first of all, give us the 101, because I'm sure there's a lot of people that are on here that are like, what does it mean? It's super complicated. So
it's a little complicated.
Just a little bit.
Oh yeah, I did wear my lymph suit. I don't know if you guys can see it, but here it is.
Yay! Oh my God. I love this suit. This is what caught my eye on your Instagram page. For those of you who don't know, Leah's Instagram page is Lymph. Let me just get this.
Love Club. Yeah,
yes.
You got
it. Lymph Love Club. Love it. So tell me a little bit more about it. Why is it so important? What is the benefits of doing this? And then we'll get into how do we go about doing this?
Sure. So just like a rough draft of what the lymphatic system is, as easily as I could possibly explain it, and in a short amount of time, is it's the most powerful, influential system in our body. So if you're familiar with the cardiovascular system, you've got this image of arteries and veins in the heart that pumps blood and oxygen and nutrients to and from our tissues. But what happens when our body is done with that stuff? What happens to these dead and dying cells? And we sort of live in this cellular soup. So the blood, the cardiovascular system and the lymphatic system together make up the vascular system. So it's just sort of this invisible system that runs alongside our cardiovascular, and it sort of picks up the things that don't belong in our body. And
Yeah.
it also, it's a huge part of our immune system because it transports and stores the immune cells. And if you see these little red dots all over my
Please
suit here,
stand up.
okay.
I'm dying to see this suit.
So you can see some of these red dots here. They're clustered in our major, like around our major joints.
Mm-hmm.
And the heaviest concentration is going to be in our head and neck. And that's because of the brain drainage that we have. We have a lymphatic system in our brain that kind of helps clear the amyloid plaque out of there and prevent neurodegenerative diseases. So we'll kind of get back to that.
Alzheimer's, dementia, Parkinson's. All of these are neurodegenerative diseases, and those are caused by these plaques that are in our brains, and lymphatic drainage helps to rid those. So it's great for our, you know, in terms of aging, cognitive decline, and all of those neurodegenerative diseases.
Yeah, totally. So lymph nodes are tiny organs of the lymphatic system, and this lymphatic fluid, which has a very similar component to seawater, it's salty and full of nutrients. And it sort of flows through these channels, these tubes, these vessels, just like blood does with the cardiovascular system.
Right.
And it goes through the lymph nodes. It goes in one side and out the other. And afterwards, you know, it passes through multiple, probably hundreds, before it's cleaned and recycled and returned back to the cardiovascular system as plasma. That's the liquid component of our blood.
Interesting. And so what is our attempt when we're doing lymphatic drainage? We're trying to cleanse out and move all of that, the lymphatic fluid towards our lymph nodes, which then cleans it. Am I getting that right?
Pretty much, yeah. Yeah, but we're also working with the brain. So, you know, our skin is an extension of our brain, and the brain and the skin communicate. So when we are doing this repetitive motion and kind of like a push-pull along the skin surface, which is where most of our lymphatic fluid is made, it's just kind of right below the surface of the skin and sort of gets absorbed deeper and deeper into larger channels, not unlike rainwater eventually makes its way to the ocean. Our internal ocean is actually right here, this little blue structure. So this is where all of the lymphatic fluid from our gastrointestinal tract and the lower body actually make its way up here, and it goes back into the left side. I'm looking at myself in a mirror image and I went to the right, but most of it goes back to the left, about 3/4, and then just a quarter goes to the right side.
That's so interesting.
So that's why we always start, we always start here at the clavicles. Sometimes you'll see people dry brushing from their hands or from their feet. But if you'd like to sort of maximize your results, the reason that we start here above the collarbone is for that reason. We're sort of creating a vacuum. It's where the pressure is the lowest in the body. And you create that vacuum and it stimulates the lymphatic system. And then that lymphatic fluid starts to get pulled back in because there's no pump for our lymphatic system. So it really relies on our muscle activation and moving our body. It's that push-pull of the muscle contraction. And then also neighboring pulses from arteries and veins. It will kind of hitch a ride on that kind of stuff.
Right. But if let's say if somebody is leading a sedentary lifestyle, and because they're not moving the muscles, then is that when we're requiring to kind of help it along, or are you suggesting that this is something that we should do daily? I already do this daily, you guys, but I want to hear from the expert. Is this something that we should do daily? How often? What's the best technique? I've never started here, so I feel like, have I been doing this wrong the whole time?
Well, I'm going to stop you right there. There is no wrong way to show up for your body. It is very confusing. I feel like we're getting sort of bombarded with the information age, you know. Yeah. We're consuming a lot of short little blips of content, and our brain really prefers books over Twitter. It really needs to digest information and really process things to understand them. And so I think we try to mirror things that we see on the screen, and then people mirror other people, and then But then we're just like, well, what is the best way? I don't know.
It's,
So
it's like the
at least you're
telephone
showing
game.
up. Yeah, you're showing up and you're trying to move your lymphatic fluid, and you're aware of this system. And I think that that's like such a great place to sort of jump off, and it's a good foundation to kind of build on from there. So I wouldn't say anything's wrong, but it's just like, okay, once we know better, we do better, right?
Right, right. Okay, I can be more effective. So
Yeah.
yes, I can be more effective in the way that I'm doing it. I did start just recently after watching some of your things. I do start by warming up my lymph nodes that I never
Excellent.
used to do. I would just start and just like dry brush aiming towards the heart, right? And I dry brush up aiming towards the heart or towards the lymph nodes in the groin area. But I think after watching some of your stuff, I'm now kind of warming those areas up. What's the purpose of that?
Well, you're going to get much better results too when you kind of prep that area, because that's where all the fluid from the body is going to go back in. So if we started from the farthest regions of our body, it's almost like Pluto. If we were a planetary system, we just want to start from the core and kind of work our way out and then back in.
Yeah.
So the reason that we're kind of warming up the lymph nodes is it's like, it is, just to get everything circulating and getting those lymph nodes prepared to receive more fluid.
Okay. And what is the best way to do that? If one were to start, and I know we're not going to drive, but look, these are my favorite ways, plus movement, like doing some sort of vibration that can kind of go across the surface of the skin. I like doing that, but I dry brush every single morning. And so what would be the best way to start if we always want to start in this clavicle?
Yeah. So you're more than welcome to dry brush once a day if you'd like, but we only really probably need to be dry brushing about 1 to 3 times a week. So if anybody's out there listening and you're just like, damn, I feel like a failure, I forget to dry brush, don't worry, you're only human, and you just show up whenever you can. I actually keep my dry brush on the side on my nightstand so that I just can't really forget to do it. And I just make sure to wash my sheets a lot because it might be gross to some people, but I do it often enough. And if I'm really exfoliating, I use like a stiffer brush,
Yeah.
and I dry brush outside to make sure I get that top layer off.
Yeah.
But whenever we're doing dry brushing, if we really want to like flow like a pro, we're going to kind of plunge above and below our collarbones.
Okay.
These are the venous angles. So the veins that right before they go back into the heart, they're pretty far down in there. Most of the lymphatic drainage techniques that you see taught by professionals, they're going to tell you use very, very light pressure. And that is true, but it depends on the areas that you're targeting. Are you targeting something that's very close to the skin? Or are you targeting something that's deeper? So we use more pressure in areas where we're trying to reach deeper structures. So if we're going to just dry brush 101, starting with the collarbones for like 10, 15 seconds, and then you can kind of rub the major lymph node clusters, which are going to be the axillary lymph nodes under the armpits. There's about 30 to 50 lymph nodes in here. They go all the way down to the rib cage. There's some in the bicep. They're everywhere.
They're everywhere.
And then you can also do your hips. So you just kind of rub your hips, and there's about 18 to 20 lymph nodes in the hips here. And it doesn't hurt to hit the posterior knee, because you've actually, I don't know, there's a couple lymph nodes behind the knee. There's also a couple lymph nodes behind the knee. And I notice that a lot of people deal with heavy legs or maybe swollen ankles, swollen feet. And it is because of that sedentary lifestyle. If we think about, human evolution, we've never been so sedentary. So,
no.
Yeah.
We've gotten very comfortable, right? We're not hunting and gathering. We're going to the grocery store or our pantry or our refrigerator. We're using a remote control. We're sedentary in our work. We've become very sedentary, which is why this is so important. And when I first started doing this, I think I was probably in my 30s. And of course, I was thinking, after a couple cocktails at night, I want to kind of get the water weight kind of moving. But this is so much more than that, because we're actually talking about our health, and we're talking about those toxins that accumulate and so what if somebody what if somebody never did lymphatic drainage and they had a little bit of a sedentary life? They worked out maybe 2 or 3 times a week. What are some of the negative health effects that can happen because of our change of lifestyle?
Well, so I think I'd mentioned that lymphatic fluid is similar, like a similar component to seawater, how it is mostly water. And the viscosity of that lymphatic fluid can change over time because it does actually transport digestive fats from the gastrointestinal tract and sends them to the liver. And so it's like when we're not moving, and this is true for blood as well, our heart is not really designed to pump blood throughout our body. It only does that when we're sedentary. It's really muscle activation that sort of pushes the blood where it needs to go to deliver the oxygen and nutrients. If we're not getting oxygen to the cells of our body, we're not going to heal. We can't heal our body, and we can't make new cells. So these dead and dying, these damaged cells, they start to accumulate in the intracellular matrix. So it's like where the lymphatic fluid is born is the fluid that surrounds the cells of our body, all trillions of them.
Yeah.
And so when our lymphatic system, because it doesn't have a pump and it is so heavily reliant on this movement, it's going to impact every major system that the lymphatic system works with. So neurological, we've got the glymphatic system and the meningeal lymphatics in the brain. And this is really meant to prevent illness and disease, this whole system. And there's also, hormones can be transported through the lymphatic system as well. And yeah, we get, we end up with a lot of gut stuff, and then we start putting weight on, and we get all of these toxins that can't really get out of our body. The lymphatic system does not detoxify. That job belongs to the liver, the kidneys, the skin, and the lungs, and the colon.
Okay.
So it's like getting all of these things moving, everything works together. And so it really becomes, this is where we see that domino effect of people's health, where we start getting sick.
It's amazing. The human body is just amazing. It's amazing how all things are, it's really incredible. And it's amazing how all things are connected, right? How this can be connected to your immune system, how this can be connected to weight gain, how this can be connected to hormonal imbalances. Yeah. And it's not the only thing. It's not the only source of that, but so you can't really do causal, but there's a correlation, there's a connection. And so in incorporating a lymphatic drainage practice, you're just going to be a healthier, more functioning human. Yeah. You might look a little bit better.
I was going to say, this is sort of where like health and beauty meet, it's our skin is a mirror, and it's a direct reflection of what's going on the inside of our body. And I think if we spend a little less time trying to fix the things about ourselves that we don't like, and punishing our body for what it doesn't look like, and pouring everything into a more authentic expression of self-love. And that is where regenerative aging happens. That's where we start aging in reverse. When we sort of like throw all the crap, the societal past that we live in, and just go, I want days that feel good. I'm worthy of days that feel good. I want to be here as long as I possibly can, and I don't want it to suck.
Exactly. And then I always feel like, because our skin is our largest organ, it's that outward facing organ. It's that organ that shows your health, right? I can tell a lot about somebody's health by their skin, but it's so interesting to me that when you focus on health first, all the rest of the stuff just falls into place. If you're looking at the function of the body and how to optimize the health and the function of the body, the way that somebody looks, and the way all of that is just going to fall into place, right? Because a healthy whole system is a vibrant, youthful system. Okay, there's a ton of questions that came in, and so I'm gonna scroll back. Somebody said, "How do I move it out of my stomach? How do you lymphatically drain out of your stomach?" And then somebody also said, "Can you do lymphatic massage if you have a low-grade fever?"
Actually, okay, so let's answer both of those. We'll back up to moving abdominal, like abdominal lymph. This is a very high concentration in the abdominal compartment here, and it's really going to be great for your gut health as well. I think a lot of us deal with abdominal bloat and things like that, and especially like during different phases of our hormones.
Yeah.
So all the seasons of life, right?
Yes.
And so one of the biggest and most impactful ways of moving the lymphatic fluid in your abdomen is going to be diaphragmatic breathing.
Ooh, that's a big mouthful.
Yeah. Diaphragmatic breathing. So basically, you know, if you've got a pulse, you've got a lymphatic system to take care of, and just know that these breaths that you take that are slow and intentional and deep, those are going to be so impactful, because it's going to create a vacuum. It's going to change the pressure in your abdomen, because again, check out this structure here. This is right here, and your diaphragm is like it's like an umbrella shaped muscle that lines the inside of your rib cage. Mm-hmm. So whenever you take a breath and you fill your lungs with air, that diaphragm goes down, and it actually pushes your liver up and down, and it strokes this blue structure right here, which is your thoracic duct. That's your internal ocean. That's like the largest lymphatic vessel in the body.
That's the largest.
And so it moves up and down, and it sort of guides that fluid back towards the heart. But you can also do things like rebounding. Vibration plates are really great. Rebounding is good because when you're bouncing up and down, you're sort of pushing that lymph back up towards the heart. And so the velocity and the gravity is going to be helpful.
That's a very interesting point, because I just learned that using a vibration plate, not only because you're looking at you're trying to rebalance and you're looking at like a torque, it helps with your whole skeletal system and muscle system, but also the lymphatic system. But in addition, because it's increasing the gravity, it's actually increasing the gravity by these vibrations. It's weight-bearing exercise, so it's increasing your gravity, and so it's actually good for your bones. It's interesting that it also helps. And how does that help with the lymphatic system? Is it just kind of what it feels like? It's just kind of shaking everything out?
Our cells and our lymphatic system really love vibration, because movement is information to the body, and it signals to our cells how we're supposed to be responding to the different mechanisms and the different forces, like mechanical forces that are pressed upon our body. So vibration is something that is like, we're not experiencing that force, that mechanical load to our bones, to our tissue, and things like that. So it really like just shake shit up.
Shake shit up. I love it. Okay, so if one did not have a vibration plate, and we're looking at that biggest, what you called lymphatic vessel, I think, right? Yeah. What was that called again? The thoracic.
The thoracic duct.
What is the best way then, besides the breathing? Is it just breathing through the diaphragm that helps to drain that, or is there a physical manipulation with your hands that you also use?
You can definitely use your hands. Abdominal massage is a great way to get things moving. That standard, going from the right side down to the left and sort of following the ascending colon transverse and then descending colon. So sometimes people will do some circular motions. You can kind of stack one finger on top of the other to get a little bit of pressure. If you've recently had abdominal surgery or you're newly pregnant, I probably wouldn't use too much pressure or really go in here at all. That deep diaphragmatic breathing is going to be your best tool. So definitely make sure that when you're following along to these videos online, that things are true and right and safe for you. If you're not sure, ask. Maybe not the influencer sharing it, but maybe your doctor or something like that.
Or
be cautious.
They can follow you. Do you also do like private one-on-one? I know you've got a place, right? I think you're in, where are you located, Leah?
I'm in Austin, Texas. So I do have a massage practice, and it is dedicated to lymphatic health and lymphatic drainage. And so it's called Align Massage and Lymphatics, go figure. And we also do online courses and stuff like that to sort of help people. I call myself a lymph literacy advocate, and
I
all
love
that
that.
means all that means is that this system belongs to you, and you deserve to know how it works, because it is the key to your health. And so when you do understand a little bit more about it, all of the other things that you're doing for your health and well-being, they all make perfect sense, because you're like, oh, I know how to do yoga. I know how to breathe
Yeah.
deeply. I get it. Stress is real, but stress is like such a huge piece too. A lot of people think it's not real and it doesn't apply to them. And that's when we start breathing really shallowly. And that's when our diaphragm's not pumping as much lymphatic fluid.
Yeah.
We get caught in fight or flight. And when we get stuck there, everything gets stuck, because our lymph is constantly responding to our thoughts and our emotions.
And that's kind of what adds to the inflammation in our body, right?
Yeah, not being able to get this stuff out of our body, it makes it really hard, because the lymphatic system, and there's still a lot more that we need to learn.
Yeah.
There's so much about the immune system that we still don't understand. But there's a lot of, the lymphatics work with the central nervous system, and there's a lot of like immune surveillance, immune response that happens there. And so it's like when we get conditions like autoimmunity, and when our cells are really, they're not intentionally doing it, they're trying to get back to homeostasis. Our body is never attacking itself. It's trying everything that it can to get better, and sometimes it gets it wrong.
Yeah. Okay, so explain to me how I saw a question go up a little while ago. How is it, a lot of people think that like when you go for a massage, and you go for like a Swedish massage, which is like a little bit more gentle, how would a lymphatic, if you, for those of you who've never had a lymphatic massage before, it barely feels like anything at times. Like I fall asleep. So explain the difference between a lymphatic massage, what that would feel like, and just like a regular kind of light Swedish massage.
So massage, just even the word massage sort of implies kneading, like kneading dough. You're sort of going back and forth. And the main focus is really going to be the musculoskeletal system when it comes to massage. When we're getting more into the lymphatic layer, we're working with the skin. We're not working on the skin. We're working with the skin. We're working with your skin and your brain to sort of move the lymphatic fluid that's sitting just beneath the surface.
So
it's
not like
one
digging
directional.
down. Yeah.
No, it's actually, so if the patient or if the client doesn't have something known as lymphedema, it's Breast Cancer Awareness Month. Breast cancer related lymphedema is probably something that maybe has crossed your feed if you're really interested in the lymphatic system. And this usually occurs when lymph nodes are removed from the body. So this can cause the tissue to become more fibrotic when the lymphatic system is been like impaired or damaged in some way. So we can use really much deeper pressure for clients like that. But if you have a fully intact, healthy lymphatic system, it's really only the pressure of about a nickel that we need to use. Like if you were to just put a nickel on your skin and just be like, damn, okay. So like a hand covered in nickels. It's just the weight of your hand that you need to use. You don't actually have to apply much pressure.
Wow.
It's pretty light.
It's pretty
Because
light.
If we press a little bit too hard, there's going to be like too much of an increase in the blood pressure, and that can kind of cause the lymphatic vessels to spasm.
So you could be actually doing some, it's not like you would be doing harm, but you wouldn't be as effective if you're using a bigger pressure than if you're just using just the weight of like your hand covered in nickels, which is not a lot. That's not a lot of pressure.
Yeah.
That's why a lot of people go and get a lymphatic massage, or they get tucked into a lymphatic massage and they think like, I didn't do anything, I just fell asleep. But you did do something pretty miraculous for your body, and you can tell
your butt too.
I mean, it's exhausting in a great way. So
yeah, a lot of
I made a mistake one time.
detox symptoms.
Yeah, I made a mistake one time where I was out on vacation somewhere, and this was when I used to drink. I don't drink anymore, but when I used to drink, I had a lymphatic massage, and then I had a couple glasses of wine at dinner, and I was shit-faced. I was like, literally, like, and you know, I have a lot of muscle mass, so I can usually handle my alcohol. When I used to drink, I don't drink anymore. But it was really shocking to me, the impact of putting a toxin in your body when you had just kind of helped that with that lymphatic drainage massage. Is that like a normal situation that happens?
Yeah, it definitely depends on the individual and their health, like what they're dealing with. We see a ton of Lyme, mold, and heavy metal toxicity. A lot of breast implant illness patients and people that are really just having trouble getting things out of their body, and they're trying to support that detoxification. And so when it comes to those people that are like pretty stagnant, if you will, I think that word gets thrown around a little too much, but it is true where it's like things aren't able to leave the body as well because our liver's compromised. Maybe we're not drinking enough water, and so our kidneys aren't doing what they need to be doing. We have to be really careful with lymphatic drainage because it can really open that valve and, you know, flush everything out. And we want to make sure that those organs are strong enough to support that. So occasionally, you know, sometimes people have to like go about their lymphatic drainage a little different. They might have to take like a binder or something that can help the liver package that stuff up and get it out. But they will often feel fatigued, tired. It might trigger a headache if they've, you know, it might temporarily just put them down for anywhere from like 24 to 48 hours. It's called a Herx reaction.
Oh, that's what I had. I didn't know it at the time, but that's what I had. And then I had a couple glasses of wine. I don't recommend that. I don't recommend doing that. We did have a question for those that are just joining. We had a question like, can you recap the method? What are the methods that are best for doing lymphatic drainage? What are some of the methods besides getting a lymphatic massage? Like, what are the to do this at home?
There's many different types of lymphatic drainage. So the Vater method is going to be best for people that have chronic illness or they're like a complex case.
Yeah.
Any sort of dysregulation in the nervous system and things like that. Like, you really don't want to be doing things like wood therapy and stuff like that. That is for people that are like pretty healthy. They've got a robust, you know, system, and beating it up isn't going to, you know, put them down for too long. So make sure that, you know, you're just trying techniques that are again, right and true for you. But
how would you be able to tell before we get into that, because I just want to like, I just need to clarify my own, how would you be able to tell if you have a compromised lymphatic system? How would you be able to tell if the Vater method is right for you, or if you're, you know, can do the stuff at home and in, you know, with a lot less help from a professional? Because I think with the Vater method, you want to go to a professional with that if your lymphatic system is compromised in any way.
Yeah. If people have had any sort of surgery where they've had lymph nodes removed from the body, I would definitely reach out and try to get with a physical therapist or a massage therapist, occupational therapist that has training in the Vater method. It's just a specific modality that's great for chronic illness. So a lot of people with like autoimmune conditions, if you're not sure, like you feel pretty good, you're like, I'm doing my thing every day and I'm okay. A lot of times the expression of lymphatic system overload and just kind of sluggishness is feeling emotionally stuck and stagnant. I do feel like this is like the soul system of our body. There is an emotional component. A lot of people will have an emotional release after they have lymphatic drainage. It's not something that happens every time, but we're really shaking out the rafters of the body. And so things come up. So if you feel emotionally stuck and stagnant, if you feel like your nervous system is dysregulated, fluid retention, maybe your rings don't fit very well. Maybe you just have like, you notice that your legs feel heavy, full, tired, your feet are puffy, some abdominal bloat or gastrointestinal issues. Maybe you've got brain fog or fatigue. And then also just feeling not spry.
Yeah.
Like feeling sluggish, you know?
Yeah. Yeah. Okay. So for those people that don't need the water method, what are the best ways to do lymphatic drainage at home on your own without using a professional? Now, of course, professionals are always better, but we're kind of in this do it at home kind of DIY life hacks now. And so how would somebody go about doing that? Do you have like a whole tutorial on anywhere that we'd be able to find?
Yeah, so you're going to sort of approach it the same way that you would approach. I feel like lymphatic drainage is a pretty specific tool. It's not something that you need to do every day. It's very time consuming. And if you were going to do your whole body, I mean, it would take you about 30 minutes. So basically, how I approach lymphatic drainage, because I'm just always balling on a budget.
Yeah.
I'm just always like a little bit late for things. And so I feel like lymphatic health, there's so many different pieces and things that we can do. So dry brushing 1 to 3 times a week is great. I have a rebounder in my dining room. I actually don't even have a dining room table. I just have my rebounder out there. And I will usually hop on that for about 2 minutes at a time, a few times a day. If you don't have a rebounder, you can just bounce on the balls of your feet. You don't need anything to move your lymphatic fluid. You don't really need any tools except your own body, gravity, and the ability to move your own body. So I do understand how some people do need tools, because tools can be really helpful if we have a chronic condition, or I know people who have frozen shoulder that are like, I can't dry brush my body. I can't
Yeah.
even put my bra on.
Yeah.
So
Exactly, because I have had a rotator cuff tear. I know how hard it is to get a sports bra on when you've got an injury. I couldn't imagine like dry brushing, but this makes me think that I'm doing not wrong. I'm not doing it wrong, but I'm not doing it as effectively as possible, because I am somebody that I'm a gadget girl. And I do like my gadgets, and I do like my regimented protocols. I do dry brush every day, but it takes me 5 minutes, which makes me know that I'm doing it wrong. But I do like a 5 minute quick thing on my whole body. I kind of gets my heart rate up a little bit, to be honest with you, because I'm dry brushing my whole body, and then I jump in a freezing cold shower.
All the tools that we can to succeed. And so it's like lymphatic drainage can also just be as quick as something like the Big Six, which is that's a Perry Nicholson thing. He came up with this idea of like, if you touch these 6 points in the body, and we should do that as soon as I finish my sentence here, let's all move a little lymph together. And so even just stimulating these choke points in the body where lymph has a tendency to get stuck, if you just did this 2-minute move once a day, it's going to be really helpful for you. And then we'll do a little lymphatic drainage for the head and neck, which will be really helpful for clearing the lymphatic system in the brain. So if you deal with migraines, if you deal with any sort of like fluid retention in your face, if you feel like you're not sleeping well, a lot of lymphatic magic happens at night when we're asleep. And so sleep hygiene is a foundational piece of your lymphatic health.
Interesting. I would have thought that was a time when it wasn't as active. That's very interesting.
Well, we're just our body's sort of powering down and regenerating during that time. So that's sort of when the body is usually doing most of the detoxifying. But the lymphatic system, and further study is needed. And now the more studies that we're seeing, it is active during the day, but it's most active at night.
Okay. So bring it, walk us through this 2-minute thing.
Let's do the Big Six. So the Big Six, we're going to start with our collarbones, of course, because this is where the magic happens. So what you can do a little bird if you'd like, or a Wu-Tang symbol, whichever feels more aligned with your vibe. And you're just going to rub above and below the collarbones. So
right on the above and below.
So you see this little V in the collarbone here where your trap and then your collarbone right in here. Oh. So just kind of plunge your fingertips in here. And I'm just kind of going like back and forth. But if it felt good, you could do circles. There's really not like a wrong way to address these lymph node clusters, because that's what we're about to do here.
And
And
this
then
is
just
kind
take a
of a
couple nice
medium
breaths.
pressure. This is like a pressure, right? A little bit of a
Yeah,
pressure we're adding.
this will be more pressure than the lymphatic drainage
Okay.
that is just sort of a different methodology altogether. So yeah, a couple good breaths, and then kind of go below the collarbones here. So now we're going to activate the largest lymph node in the neck. It's going to be like right here, just about an inch below the ear. And
hold on 1 second. Hold on 1 second. For those of you who are on my Saturdays normally, and I talk about drainage behind the ear, bring it up to the ear and bringing it down the neck, that image is exactly what we are talking about here. When we're dealing with eye bags, or we're dealing with fluid that creates gels in it, and we want to lymphatically drain the face, we're pushing the fluid back towards the ear channel and then down the neck. I know it's not called the ear channel, but that's
all right. So,
okay.
so now we're going to hit that largest lymph node in the neck. It's right next to the vagus nerve, so it's just below here. So you could just use like a couple fingers here and do some little circles.
Ooh. Oh, that feels so good.
Mm-hmm. Now just give it a little tap. All right, so so we've got 1, 2, we're moving on to number 3. So now we're going to do the axillary lymph nodes in the armpit. So I want you to like rub in your armpit here. It's good if you make like a weird face. That way, if anybody's watching you do it, because you're like on an airplane, I really love to
get in there,
my lymph in public and just watch people and have their reaction. I'm just like, whatever, I might live a little longer than you. No.
Totally.
All right.
Listen.
So that's number 3. Now we're going to move on to the abdomen. So this is number 4. What you can do is you can stack your hands on top of each other, and you can just do some little circles in one direction.
I hope
little circles in
everybody
the
watching
other
this
direction.
is get up and do this with us, right? Because you're going to feel a difference.
And then you can even give your little thoracic duct here, you can even give it like a little hello, little pat on the back, good job. And then we'll move down to the inguinal lymph nodes. So you'll rub these in one direction and then rub them in another direction. Same thing, let's do a little tap, pat on the back. Thanks for all you do. And then we're gonna do above and below the knee.
Okay.
Can you see me, Tony? All right, I don't know.
Wait.
I'm just gonna go above
Scoot
and
back
below.
just a little bit, Leah. Scoot back just a little bit.
I'm actually gonna scoot forward.
You're gonna scoot in.
See if I can get it. Can you see these lymph nodes back here, guys? There's a couple lymph nodes back here, and they're really responsible for draining the whole back portion of the leg. So you can go above and below these, the knee joint here, and then give that like a little tap. I think it's easier to do standing up. I got in the swing of things, you know?
Yeah.
So now that you've got all of these choke points stimulated, what you'll do is bounce on the balls of your feet if you're able. If not, you can just skip this one, and you can shake your hands out a little bit.
Oh, it does feel like things moved.
And that's it. It's so easy. That's just like one of the easy things you can do. I love legs up the wall. You stick your legs up the wall. It's actually going to make it easier for your heart to pump blood, and gravity is also sort of moving everything back down towards the heart. So that's a pretty powerful lymph mover as well. So maybe you've got some tools, right? You got maybe a vibration plate, maybe a rebounder, maybe some sort of massaging tool, your dry brush, but then the hands-on stuff, it's going to be your breath, muscle activation, and that diaphragmatic, oh yeah, I said breath already. And
then move.
So managing our
massage, you can do a lymphatic massage, you can move, you can do the diaphragmatic breath, this kind of getting in there in the lymph nodes. Now see, that's something that I wasn't doing. I wasn't doing that at home. I was just doing this more of the superficial kind of
see what you
bring,
notice too.
yeah.
I'll be curious to see how you feel, because it's something that you're very familiar with and you know exactly how you feel baseline, and now you're adding this other layer of understanding into it, and it's really just going to elevate your entire self-care practice.
I'm so grateful for you for that, because I think that literally just changed the way that I'm going to dry brush. So if I did that first and then I came over the top, once that's already warmed up and stimulated, and then slowly started moving just barely. And I like the kind of, somebody asked a question of what is the best kind of dry brush. I like the ones with like the little knobs on them. What do you normally use?
That I've actually never seen a dry brush like that. It looks pretty cool. I have the Aura Sweeper by Wildling, which is great. It is a natural bristle, so it is pretty fibrous. It's probably not suitable for sensitive skin. I also have something, I don't have it on me. It's called the lymphatic brush. The lymphatic brush is this like contoured, butter soft brush that is so perfect for people that have lymphedema, lipedema, maybe that like delicate aging skin, any sort of skin condition where dry brushing isn't for you. Dry brushing is for you, because this is not a dry brush, it's a lymphatic brush. So check that out. It's really an awesome tool.
I love that. I might try to get a link from you later, and we can share it with people that are curious, because if you don't have a dry brush, you might as well get one that's going to be the most effective.
Yeah, I feel they're all just different sizes, different shapes. Like sometimes you got to like try stuff out to be like, actually, that's like not for me.
I can't tell you how many trial and errors that now have me. I'm to the point. I even have like, it's like Goldilocks, right? This is a little too soft. This one's a little too stiff. Like you have to find the one that kind of works right with you. So I can't tell you how many I've gone through to get the handful that I really love. So I'm curious about that one. What was the name of that again?
It's called
Leah, because
it's called the lymphatic brush. They make one for the face as well as the body. And it really, as soon as I used it, because I'm very familiar with dry brushing, and while lymphatic stimulation and that lymphatic drainage is very subtle, I feel like I have like spider senses when it comes to that stuff. And as soon as I started using this lymphatic brush, I was like, whoa, like I immediately felt things moving, and I was like, it's different. So
the brush
pretty excited
construction.
About it. I mean, I'll go get it real quick if you want me to.
I mean, I'm kind of.
Do you want to like? Why don't you do like a little dance and put like a little waiting time on something? I'll go get
like
it.
Like if we had a Jeopardy clock. Dun, dun,
okay.
dun, dun,
go get it real quick.
I'll show you some of my. While Leah's going to get the ideal lymphatic brush, I'll show you some of mine. I like this one. This is by Spa Alexis. I think that the ones that I like are on my Amazon store, so you guys can just click on that link in my bio. It'll take you to my Amazon store. But these are the kind of the ones that I like, that have a handle so that I can do my whole body. It also has these nodules that kind of help to move the fluid around. But then I do kind of use a stiffer brush for my face, because I want that cell turnover as well. And then I have this one, which I love, which is by Mio. And I love it because it's a combination of these kind of two sides. Okay, show me what you got.
Awesome. Okay, so this is the lymphatic brush.
Oh man, that looks way better.
You can see these like little bumps on it.
Yeah.
It's so soft, and the design is really amazing because it kind of contours to your body. So I actually call this the thyroid hug because what I'll do is I'll brush my thyroid with it, and I just move it really, really slowly. And so so dry brushing strokes are going to be like trying to get that last stubborn ass line of dirt into the dustpan. You're using like really fast, aggressive strokes. I mean, not aggressive like pressure wise, but just very fast. Yeah. The tempo of the lymphatic brush is going to be like slow and steady wins the race. So definitely recommend this. I've got a promo code. I think it's just Lymph Love Club for 10% off. But
so would you be able to, like, if I had if I put you as a collaborator after this, so it went on both of our sites, would you be able to give people that code there?
Yeah, for sure.
Okay. Okay, so I'll do that. I'll invite you as a collaborator, so it'll sit on both of our sites. And then, because I know that there's going to be a ton of questions, I'm going to scroll back a little bit. People saying, love this topic. I just donated blood the other day. Is it a good time to be more aggressive with cleansing when you've donated blood? Interesting.
I don't think so. Your body is very wise. It's going to replenish everything that you donated. And honestly, it's awesome. Thank you for donating blood. Breast cancer patients really need that blood. They really rely on that blood. So please donate when you can. But I would be just a little gentle with your body as it's kind of repairing itself and coming back into that homeostasis.
And we do have somebody who's going through chemo right now. So we want to give a lot of love out to Makila 1958, who's going through chemo right now. How might this help her? And we went through that a little bit earlier, but let's just recap how when you've got a chronic disease or you've got cancer and you're going through chemo, how would this help? Because you want to get rid of all of those toxins put in your body to kill the chemo. But
well, it's just exhaustion is usually like the biggest symptom for people, but they also can see some fluid retention with chemo. So it's just a matter of sort of supporting the body when those immune cell counts are down and they're anemic and they just need to really restore and recover. So just do everything that they can in the most gentle and compassionate way. So don't try to do too much, but definitely support your lymph however you can.
Right. And then somebody says, does this help with menopause and bloating?
Definitely. I have a lot of menopausal clients, and while herbs are really helpful, it is also helpful to just support the system that works with everything.
Yeah. Somebody just said, I'm doing it today. Today's session is a sign. It takes today's session as a sign. So
nice.
That's great. That's great. If we can change, look at what you just did. You just changed somebody's life. They're going to start doing this and they're going to live they're going to live longer and be healthier and function a lot better. The best great as a wish list for a birthday. Yeah. So if you want to give somebody a lymphatic massage for a birthday, that is going to be something that, I mean, regular muscle massage is also great for you, but this is on a whole different level. We're talking immune system here. We're talking, regenerative aging here. Like this is good. Vibration. Oh my God, I cannot say the word.
Vibration plate.
Vibration plate has been on my wish list. I mean, that's so interesting. That's another plus for these vibration plates, in addition to having weight bearing exercise and that balance, but to help with the immune system and lymphatic drainage and lymphatic health, I think that was a real amazing piece of information there. So lymphatic brush. Okay. Do you have to, somebody's asking, do you use oil when you're doing lymphatic massage? So some
people do, but traditional water method is no oil, because sliding on the skin, it's a little less effective.
Sliding on the skin is a little less. So normally you want to do it on dry, well, hence the word dry brushing. But when you're doing a lymphatic massage, even, you don't use any oil. You're just sliding on the skin.
Yeah, but not really sliding. It's sort of, I call it skin play. You're basically pushing or pulling in like a two-directional manner is how you're kind of doing like the hand placements of movement. Or like movement with the skin. The opening of like a lymphatic collector, they have these little fascial hairs that kind of are connected to these openings. So they sort of like will open and close like that. And so
I want to see a diagram of that. I wish I would have printed something out.
When you're kind of torquing the skin, it sort of stimulates them to kind of like open and close and collect more fluid in. When you're swiping and you're sort of doing these like long, that sort of turns more into massage. And that can, again, it just is like a little bit too much of like an increase in circulation, which can kind of slow things down.
Oh, I wonder if that's what I've been doing. I've been doing my 5-minute, like trying to get it all in, my 5-minute daily, and maybe I'm doing it too quickly and not the right pressure. And I definitely, I've learned a lot, so much in the last 50 minutes of being on here in terms of my own self-care practice. I hope you guys have learned a lot as well. Somebody just said, Leah is one of my absolute favorite follows on Instagram. Thanks for all the free wisdom you give away.
Oh, thanks. Thanks for being here.
And then let's answer a couple more questions, then we're going to jump off of here. Somebody asked, is it good to exercise after lymphatic stimulation?
Yes, I would stimulate the lymphatic system first and then exercise. So something like the big six and then jumping into your workout is definitely going to maximize it. But just know that the muscle activation alone, that is your lymphatic drainage.
I love it. Muscle, you guys, that's another check for like, get your ass in the gym, right? Muscle activation alone is your lymphatic drainage. Somebody asked, can you repeat the 6 key spots, the angle at the neck, the axillary zone, behind the ear, the knee, what else was it? The 6 key spots, just quickly.
Collarbones, the ear, behind and below the ear, armpits, abdomen, hips, and then behind the knees.
Hips. Behind the knees. So it was the hips that was missing there. Okay. And then how often should I do the demo? How often, the demo that you did, Leah, how often should one do that? I think you said every three times a week.
So the lymphatic stimulation, it should be done every day and in every way that you can think of, wherever they fit into your schedule. But the big six, because it only takes a couple minutes, you can do that every day.
Okay. Awesome. So it might be better, in my best interest, to, instead of just quickly dry brushing for the exfoliation of the skin, just instead of doing that, to do the big six and then
dry brush.
And then
I've got like a similar approach to dry brushing, and I have a free dry brush guide that there's a link in my bio if anybody wants that guide. It just has pictures of me as a cartoon. It's me as a cartoon and my lymphatic system. And then that way it's just got some step-by-step things that you can do.
I love it. Well, this has been just information packed. I am going to post this to the main feed. For those of you who are new to this live, I'm here every Saturday. It's all about healthy aging. How do you feel? How do you function? How do you look? How does that translate to healthy aging? And lymphatic system is definitely a big part of that. So I cannot thank you enough, Leah. It's been just so much information. Make sure that you guys check out Leah's Instagram page, and we'll click that link in the bio, because I want the cartoon of your lymphatic system so that I make sure that I'm doing it right. All right, everybody. Thank you guys so much. Thank you, Leah. Do you have anything left you want to say?
Man, take care of the stress piece. Yeah. It's so important. What's going on in the world is really crazy, and we're having a hard time regulating our emotions. And don't run away from those uncomfortable feelings or conversations. Like, keep having those, but definitely make sure that you're coming back home to your body when you're done, and regulating when you can. Yeah. So this is more important than ever before, because with everything going on in the world, taking care of a little self-love on your lymphatic system is more important than ever before. Okay. Well, it's how we serve others. Yeah. Thank you so much, Leah. Thank you. Okay, everybody, have a great rest of your Saturday. I'll post this to the main feed. Bye. Thank you. Bye.